Yes, hi. Today we'll be talking about cognitive impairment, autism spectrum disorder, otherwise known as ASD, for the disability profile assignment 3. So, ASD is basically a disorder that consists of a collection of social, communication, and behavioral impairments that vary with respect to severity, developmental level, and chronicle age. Uh, it's- so, It's basically a developmental disability that's just caused by differences in the brain. Diagnosis of ASD now includes several conditions that used to be diagnosed separately: autistic disorder, pervasive developmental disorder not otherwise specified, and Asperger's syndrome. These conditions are now all called in unison autism spectrum disorder. Unison. There is no known single cause for autism spectrum disorder. It is, however, generally accepted that it's caused by abnormalities in brain structure or function. Brain scans show differences in the shape and structure of the brain in children with autism compared to in neurotypical children. So, so the following characteristics an ASD person possesses are as follows, which being that of number one, social communication and interaction skills; number two, restricted or repetitive behaviors or interest; number three, skills that consist of delayed language, delayed movement, and delayed cognitive or learning; number four, behavior, hyperactive, impulsive, and/or inattentive. Number five, disorder, either of epilepsy or seizure. Number six, habits of unusual eating and sleeping. Number seven, reactions that could be of unusual mood or emotional. Number eight, worry, which can be of anxiety, stress, or excessive. Number nine, lack of fear or more fear than expected. And number 10, gastrointestinal issues. There is often nothing about how people with ASD look that sets them apart from other people, but people with ASD may communicate, interact, behave, and learn in ways that are different from most other people. The learning, thinking, and problem solving abilities of people with ASD can range from gifted to severely challenged. Some people with ASD just simply need a lot of help in their daily lives, or whereas the other half will just need less resources. Currently, there is no treatment on shown to be cure for ASD, but several interventions have been developed and studied for use with young children. These interventions may reduce symptoms, improve cognitive ability and daily living skills, and maximize the ability of the child to function and participate in the community. So here are the ones that state which, according to applied behavioral analysis, here are the following: early intensive behavioral intervention, which is a type of ABA for very young children with an ASD, usually younger than 5 or often younger than 3. Pivotal response training is a variation of ABA that works to increase a child's motivation to learn, monitor his own behavior, and initiate communication with others by focusing on behaviors that are seen as key to learning other skills, such as language, play, and social skills. This training works to generalize skills across many settings with different people. We have discrete trial teaching, which is common form of ABA, which what is being taught is broken down into smaller steps and taught using prompts and rewards for each step. Prompts and rewards are phased out over time. Uh, they tend to use the LOVAS model. The LOVAS model, it basically consists of 20 to 40 hours of highly structured discrete trial training, integrating ABA techniques into an early intervention program. The intervention typically begins when the child is between the ages of 2 to 8 years old and no later than 12 years old. The technique utilizes child specific reinforcers to motivate and reward success. We have another model, the early state demo model is an early intervention program designed for infants, toddlers, and preschoolers ages 12 to 48 months with autism. We have speech therapy. Since people with ASDs have deficits in social communication, speech therapy is an important treatment option. It is speech therapy with a licensed speech language pathologist helps to improve a person's communication skills, allowing him to be better express of his needs or wants or her needs or wants. For individuals with ASD, speech therapy is often most effective when speech language pathologists work with teachers, support personnel, families, and the child's peers to promote functional communication in natural settings. Some individuals with ASD are nonverbal and unable to develop verbal communication skills, and the use of gestures, sign language, and picture communication programs are often useful tools to improve their abilities to communicate. Occupational therapy. It's often used as a treatment for sensory integration issues associated with ASDs. It is also used to help teach life skills that involve finer motor movements, such as that be of dressing, using utensils, cutting with scissors, or writing. OT works to improve the individual's quality of life and ability to participate fully in daily activities. Physical therapy can be used to improve gross motor skills and handle sensory integration issues, particularly those involving with the individual's ability to feel and be aware of his body in space. Similar to OT, physical therapy is used to improve the individual's ability to participate in everyday activities. PT works to teach and improve skills such as walking, sitting, coordination, and balance. Physical therapy is most effective when integrated in an early intervention program. Medications. Pharmaceutical treatments can help ameliorate some of the behavioral symptoms of ASD, including irritability, aggression, self injurious behavior. Additionally, by medically reducing interfering or disruptive behaviors, other treatments, including ABA, may be more effective. Medications should be prescribed and monitored by a qualified physician. Res- risperidone is the first FDA-approved medication for the treatment of symptoms associated with of ASD in children and adolescents, including aggressive behavior, deliberate self-injury, and temper tantrums. Another one is aripiprazole. Is also FDA approved for the treatment of irritability in children and adolescents with ASD. A 2009 study published in Pediatrics found that in a group of 98 children, by week 8, 52% of those taking aripiprazole in the form of Abilify experienced a 25% or greater reduction in autism-related irritability symptoms compared with 14% of those who took the placebo. We have other therapies which can be used to examine the right behavioral intervention for either yourself or for the child. It's important that the intervention incorporate the practices of effective behavioral interventions rather than have a name or a specific methodology as discussed. So there are some issues to be aware of. So a person with ASD can has some issues such as being having anxiety, depression, somatization. We have rule breaking, aggression, self harm, inattention, hyperactivity, impulsivity, and abnormal thought. Most people with autism can have problems using language, forming relationships, and appropriately interpreting and responding to the external world around them. Autism is behaviorally defined developmental disorder that begins in early childhood. The signs and symptoms of autism may be apparent by the time the child is 12 to 18 months, and the behavioral characteristics of autism are always evident by the time the child is aged 3 years old. Either way, autism disorder persists throughout the person's lifetime, although many people are able to learn to control and modify their behavior to some extent. In terms of ASD, there are some TR treatments that might be able to help with the ASD, uh, which are the following. We have art therapy. It's when the clients use art media, the creative process, and the resulting artwork to express their feelings, reconcile emotional conflicts, foster self awareness, manage behaviors and addictions, develop social skills, improve reality orientation, reduce anxiety, and increase self esteem. Art therapists work with many populations, including not only just people with ASD, but those with mental health, rehabilitation, medical, educational, forensic, wellness, veterans, hospice, older adults, and developmental disabilities. Mu- Music therapy, on the other hand, is basically a clinical and evidence based use of music interventions, basically to accomplish individualized goals with a therapeutic relationship with a credentialed professional who is credited with an approved music therapy program. So the music therapist will work with many populations uh, in ASD, as well as with those with Alzheimer's, veterans, premature infants, mental health, wellness, medical, developmental disabilities, hospice, and older adults. Recreational therapy. This has been flirted around in the past previous classes. Well, basically, it's a systematic process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with illnesses and/or disabling conditions as a means to psychological and physical health, recovery, and well-being. We have social skills, skills that enable individuals to function competently at social tasks. It can be defined as a complex set of skills that include communication, problem solving, and decision making, assertion, peer and group interaction, and self management. So, here are the following recommendations for the TR official to look upon. So, the principle of adaptation. So, one, adapt only when necessary. Many people with disabilities lead very independent lives that require very few additional accommodations and supports to participate in leisure activities and environments beyond those typically employed by most. Two, adapt on an individual basis. Be certain that adaptations which are considered and designed for an activity are in fact relevant for a particular participant. Oftentimes, recreation programs purchase modified or specialized equipment or hire extra staff in anticipation and assumption of its needs by prospective participants with disabilities. So the best approach would be that it's good to be prepared. View any adaptations as temporary. Consider adaptations as transitional until the person can learn the skills and behaviors to participate in standard or typical way. Some modifications like use of a wheelchair, dog assistant, prosthetic device may always be necessary. However, in my mind, prevent people with disabilities from becoming unnecessarily dependent on those adaptations, thereby further limiting future options and opportunities for this person to enjoy these activities in more inclusive settings. Adapt for congruence. Any adaptations or modifications should make sense, not only for the person using them, but to others observing their use. Unique or exaggerated adaptations and modifications, those which may not be usually seen or experienced by non-disabled participants, may have an unintended consequence of further limiting the inclusion and acceptance of the person with a disability. Lastly, adapt for availability. Adaptive equipment, materials, and supports provided in one recreation environment may not be readily available in another comparable environment. People just want to know that wherever they go and whatever they choose to do, they will have the support they need to be included and successful in this experience. Thank you.